Engaging our students in active learning is an important part of our responsibility as nurse educators. Oftentimes, though, there can be many distractions that happen long before students get into the classroom that prevents them from focusing. Our goal is to make sure that we are active partners with our students to help make sure they stay on track and ultimately that they make safe patient care decisions. Welcome back, everybody, to Dr. Sellars Educate. We're thrilled that you're back. If you haven't already, you want to go ahead and subscribe to this channel on YouTube or whatever platform you're watching us or listening to us on, so that every single time a new snapshot is developed and published, you'll be notified right away. All right, so let's take a look at this statistics and let's see if you all can tell me what you think this is. All right, so 10 to 12 minutes. 10 to 12 minutes. What statistic do you think that is correlated with? Well, if you think it's correlated with the time that our students are able to connect with us without getting distracted, that's about right. Some research says it's even shorter than that. So 10 to 12 minutes is the amount of time we have with our audience. Some say it's 8, some say it's 15, so we just decided to go with the middle approximated time. That's how long we have to keep our students' attention span before they start to drift. And we know educator engagement starts with our ability to truly connect with our students. Our goal is that students are able to walk away having a deep comprehension of concepts in a way that allows them to make safe patient care decisions. So let's talk about some of the strategies. If you haven't already, go ahead and pull out Billings and Halstead. Okay, it is the 6th edition that we are using. Okay, so the 6th edition is the current one that exam writers used in 2023 when they were developing those exam questions. However, if you have the 7th edition, that's great. We also have mapped right here in the description the actual, or we included the crosswalk between the pages in the 6th edition and the pages in the 7th edition. Chapter 16 is going to give you a lot of great examples about specific teaching strategies to help keep our students engaged. You're going to start on page 287 where you see the evidence regarding student engagement. So I'm going to skip down to the official second paragraph. It says, first academic challenge illuminated the relationship between emphasizing higher order learning and courses that students perceive as focusing on more complex topics, challenging their thinking skills. Okay, so this is alluding to specific results in a 2016 report that quoted 517,000 students' engagement being categorized into 5 quality indicators. Okay, so academic challenge was one of the indicators. The second one is learning with peers. The third is experiences with faculty. Yes, it matters about the relationship that we have with our students, the partnership that we develop. Number 4 was campus environment. And number 5 is high impact practices. Okay, so again, this is chapter 16 in the 6th edition. And if you have the 7th edition, you can take a look at the crosswalk right here in the description, and it will give you exactly what page numbers you want to focus on. So educator engagement, it starts with our ability to really connect with those 5 specific indicators that were described in the research in 2016 that is listed out in chapter 16 of Billings and Halstead. When you're going on this journey towards excellence, we want you to achieve your certification as a nurse educator. And you can do that successfully in just 60 days. We are an accredited provider, and why that's important to you is that means that we are required to uphold very high standards when it comes to the content that we develop. So every part of our curriculum is aligned with the actual NLN nurse educator competencies that are specified and described in the NLN CNE Candidate Handbook. You can find that handbook right on the nln.org website. There are now 4 different certification exams. Okay, so we have the CNE, which is known as the Academic Nurse Educator exam. There's also CNE Novice for those colleagues that have less than 3 years of experience in the academic setting. There's also CNE Clinical, primarily for those colleagues that are in the clinical setting, the SAMR Skills Lab, and then there is a new exam, and it's called the CNE PV for those colleagues that teach in a practical or vocational nursing program. You only need 60 days. It's about having the right resources, which is Billings and Halstead, okay? And then Caputi is also a supplemental textbook that we often use to help colleagues really be able to focus and have clarity around those specific behaviors that are described in the NLN Nurse Educator competencies. So step one is just take a moment and reflect on where your knowledge is related to the content. Okay, so these are the steps that you're going to follow to make sure you're increasing your student engagement as much as you can, trying to get closer to that 12 or 15 minutes, since we know research says that's the maximum amount of time we're going to have to keep our students engaged before they start to drift. So thinking about content knowledge, what content do I have knowledge about? What are those specific firsthand experiences that I'm able to bring into the classroom? That can be a little bit of a show and tell, or maybe we share a story, right? Storytelling is so powerful when it comes to helping our students really connect with the concepts that we're describing. Okay, so first step is reflecting on what content knowledge do I have? How do I connect my students with the content that I will be facilitating as part of their learning journey? The second consideration is going to be content retention. How deep and complex are the concepts that I am sharing with my students? If we know that it's a high level of complexity, then retention may be low. So what can we do? We can explore ways to engage in micro learning, where students are really learning about small bits of information packaged in a way that's going to allow them to scaffold their learning. Just like the Bloom's taxonomy describes, pages 188 through 190 in the 6th edition, we start at that lowest level, which is remembering or memorizing, but we can't stay there, right? We have to draw on prior knowledge, building our students' level of knowledge as they progress in our courses and progress through our curriculum. So I want to think about how likely are my students able to retain this information, these concepts that I'm teaching them about. The third consideration is application. When are my students going to have a chance to apply these concepts that I've discussed with them? We don't want there to be a long time frame between the time students actually learn those concepts and the time they actually apply them. Okay, so we want to bridge that gap as much as we can, because we want the students to be able to engage in what's called deliberate practice theory, where they are learning content. We're intentional in the concepts we're teaching students about, and the students are having a short time span between when they learn it and when they actually practice it, when they actually apply those skills. Okay, again, that's deliberate practice theory. When are my students going to have a chance to apply it? And then to close the loop, we've got to validate, right? We've got to put our stamp of approval on the knowledge that our students have been able to grasp. The only way we can confidently put our stamp of approval on that knowledge comprehension is to evaluate, to assess whether or not students have the full, deep comprehension of concepts that we need them to in order to build on that prior knowledge, right? We got to confirm that it's solidified before students go to that next level of learning. All right, so hopefully you took some really good notes to help you clarify any muddy points you had related to student engagement as described in competencies 1 and 2, and our ability to facilitate learning in the academic setting. And that's across the continuum, whether that's in the academic didactic setting, the clinical, skills lab, or simulation setting. So let's take a look at our thought-provoking question and let's see what you think about this one. This is related to curriculum. You are mentoring a novice nurse educator about data collection in curriculum development and program evaluation. Which statement best describes the role of nurse educators in understanding data collection methods in curriculum evaluation, right? Because we have to validate that learning has happened. A, to explore the relevance and effectiveness of clinical experiences. B, to evaluate trends in student and faculty satisfaction with the program. Or C, to provide objective evidence for curriculum revision decisions. When you get to the CNE exam, you want to consider 2 thoughts. Thought number 1, what is this question really asking me? Okay, be clear about that. Thought number 2, what is it that I know for sure about concepts included in this question? You will have 150 questions on the exam. 130 will be scored, 20 will be unscored. We don't know which ones those are. So you're going to assume that every single question is going to be scored. You will have 3 hours to take the exam. Okay, so we want you to manage your time wisely, pace yourself as you explore what the best answer is, because oftentimes there's 2 good answers, but there's only one best, one correct answer. So if you chose C, you are correct. Okay, so to provide objective evidence for curriculum revision decisions. In the STEM, you see a statement that's very common and similar to what you will see on the CNE exam. And then you see a question. This question was all about what is going to be the best option to describe the role that we have to understand data collection. Well, it's to provide documentation for us that learning has actually happened, and if it has not, then there are changes that we need to make, right? There are revisions that we need to make to our curriculum. And we get a lot of data from students on their educational journey. We get data from students when we're having conversations. We get data whenever students are completing the end of course surveys. And we also get data whenever our students are graduating and become alumni. They give us feedback. We get feedback from our healthcare partners, whether or not our students are able to transition to practice easily or if they struggle, right? There's so many data points. In addition to the quantitative data, students give us during exams and quizzes as well as assignments. When you're on the journey towards achieving your certification as a nurse educator, it is a transformational process that's happening. You're learning, you're growing, you're integrating these evidence-based practices, and you're seeing more light bulb moments. That's ultimately the goal, because you're able to engage in these evidence-based practices, such as the ones that we discussed based on content from Billings and Halstead in Chapter 16. We are excited to go on this journey with you. We launch a CNE in 60 Days cohort every 60 days or so. So make sure you go to our website, because there's no need to struggle. There's no need to waste time or money on resources that are not going to help you achieve success on the CNE exam. We hope this snapshot has been helpful, and we look forward to seeing you in our next one. Have a great day, everybody.